Hello, it's Anthony Chadwick from the Webinar Vet. On another episode of VETchat, this week the Webinar Vet meets the Holistic Vet. It's always good to have a title, isn't it? So it's Nick Thompson who's on the line today. Nick, thank you so much for agreeing to come on the podcast.
How are you, Anthony? It's great to be here. Thank you.
Yeah, well, perhaps first of all, just give us a little bit of a history. Obviously, a vet like myself, of as we discussed earlier, a similar vintage. I think I'm a few years older than you. Qualified from Edinburgh, fantastic
Yeah,
school. And
indeed.
then tell us a little bit about the history going forward.
Okay. So I did intercalated honours at Edinburgh. I did pathological sciences, virology, microbiology, biochemistry, parasitology, blah blah. The whole works really, because I thought I wanted to go into science, or at the very least, I had an inkling that I might be going into what they called alternative medicine in those days. And I thought I wanted to have a background. I wanted to know my way around a laboratory, my way around references and papers. So I found that very, very useful. I qualified from Royal Dick School of Veterinary Studies in 92, went into practice. I did 7 years in practice because you'll laugh at this. I initially wanted to be James Herriot, so I went to Yorkshire, and really, really enjoyed. I started in mainly a pig practice, but they had a small animal branch, and so doing a bit of everything. And then went up into the Dales, working from just near Ampleforth in Helmsley, up into the Dales, and thoroughly enjoyed that. Learned a thing or two up there, I can tell you. And then came down to and then kind of had a revelation. Really, I went to my boss while I was there, and I said, can I study some homeopathy? And he said, well, if if you're going to do it, you might as well do it properly and go and do a course. So, strangely enough, a very conventional vet started me off on my journey, and so I started studying homeopathy, and then I came to the revelation. I just thought, am I going to be a conventional vet who dabbles in some alternative things, or am I going to nail my colours to the mast? And being the extremist that I am, I thought, right, I'm going to absolutely go for it. So then I moved down to the south coast, just near Chichester, and I did 4 years down there with a guy called Mark Elliott, and we were in practice together doing homeopathy and herbs, and began to get interested in nutrition at that point, but we were using kibble then, so I've cut my teeth in the kibble industry back in the day. And then in 1999, I just thought, right, I'd like to set up my own practice. So I did so. I set up my practice, holisticvet.co.uk, starting then. And really, the main drive, I was doing horses and cats and dogs and a bit of everything. But gradually, as the raw movement has become more and more prominent and more popular, that's really where it's led me. So I find myself today to be one of the grand old men of raw food in the UK, and I'm very, very happy with that as a state of affairs. I do a lot of telephone medicine these days. I see people as well every month. I'm based in Wiltshire, just near Bath, and I'm doing a lot of consultations when nutrition is key. So I see a lot of itchy dogs, and I see a lot of dogs with gut problems. I see a few healthy dogs where people are saying, right, well, I'm on kibble. I really look after my own diet, and with my kids, I'm very careful about what I feed them. I'd like to get my dog off ultra processed food, which is essentially what it is. Kibble and tins, it's ultra processed food. And I'm finding, surprise, surprise, that we can have incredible health benefits to these. They don't need to be itchy or squitty, but they can be just an average dog, averagely healthy. But we change their diet and they become supremely above average. They, slightly smelly ears disappear and really resolve beautifully. Teeth improve, gut function improves, poos improve, anal glands improve, coat quality improves, hot spots improve. Even with pollen sensitivities, we can just take the inflammatory base of that
Mm.
down a bit. They're always going to be pollen sensitive, but if you can take down whole body inflammation, that can really help. Also with indoor allergens and all that
I used
stuff.
to talk a lot about the pruitic threshold when I was doing a lot of dermatology, and
Yeah,
actually, if you've got a dog that's got some malassezia, it's got a bit of a flea allergy, maybe a dust mite allergy.
yeah,
If you can sort out its malassezia, by washing a topical treatment, obviously you treat for the fleas. If I think flea treatment potentially, and I feel I'm partly responsible for it. I set up the first pet health club in '99.
oh, it
But
was
as a
you.
dermatologist, obviously, I was, obsessed with a couple of fleas on a flea allergic dog or cat can cause a lot of problems.
Yeah,
But actually, if you treat that dog for fleas, treat its malassezia, the fact that it's still got a dust mite allergy is still there subclinically, but you've taken it below its scratch threshold, its itch threshold, by
yeah.
removing a couple of the elements. So, and of course, diet is a big part of that as well, with allergy and so on.
It is very much so. I think what people. I think there's a bit of an us and them within the veterinary profession. They say, "Okay, you're a holistic vet. Oh yeah, yeah. Well, I'm a conventional vet." But you know what? We all went through the same
Mm,
training, and actually, the most important thing for me is we all want the same thing. We want happy,
yeah.
healthy pets, happy, healthy owners, and to to uh, to get to that stage of resolution and to educate our clients so that they can manage their pets from a position of knowledge. I think
Mm.
it's really really important.
No, I think you're absolutely right, and I think it's interesting. Use holistic. I talk about being holistic a lot because I think as a profession we're much more holistic than, say, for example, the doctors who are often,
Yeah,
holistic for me. I think it's a Greek word, isn't it? It comes from the whole idea of treating the whole animal. I mean,
very much so.
by all means, give me a different definition, but I've always seen it as treating the whole rather than the part. So even
Mm,
with skin diseases, I would always go in and give well, first of all, a thorough history, but then, of course, a thorough clinical examination because
mm,
if that dog has a heart murmur, you need to know it before you start looking at the skin. And I think sometimes with the 10-minute consults, it's very difficult to do all those things. And
mm, mm,
one of the reasons I think I was reasonably successful with dermatology wasn't that I knew more than other people, although, probably I did because that was my particular area of interest, but it was actually just spending the time with people,
mm,
having that consistency of they saw me every time I came in. I got them back in. Often when I was taking a history, which vet do you see at Mr. Smith's practice?
mm,
Well, I've
mm,
seen all seven of them. You
mm,
immediately realize that unless communication is absolutely tip top and all the vets agree with each other, there's going to be a bit of treatment changing and flip flopping going on.
mm.
So that consistency of having one vet looking after a patient, at least for that part of it, for that series of consults, I think is so important, isn't it?
I do, and we were talking about this before we came on. I think we don't do ourselves any favors um, by having a system whereby you treat and then you say come back and see us, i.e., come back and see the practice in 2 weeks. What I love to do, and I'm the only vet in the practice, so I do get this consistently. But in a multi vet practice, what I personally would be doing would be to say, come back and see me in 10 days or 12
Yeah,
days, whenever you're next on, because
yeah,
then you can pick up the story. When I'm consulting, my first consultation is 45 to 60 minutes, and I will spend an half an hour or longer looking at a questionnaire that I sent out to the clients and looking at the vet history, looking
yeah.
at the lab work, and bringing that all together. It's like cramming before an exam. so that when I lift the phone to talk to the client, I have crammed all that information, and I know when Buster had his first vaccine, and when Buster first started itching, and when Buster first had
Mm.
the hotspot, and when they changed the diet, and what was the effect of the change in diet, because I've got the vet's impression and I've got the client's impression as well, and I find that's really, really valuable, and that plays into this holistic medicine, because what we were speaking about before we came on was the attrition rate, the number of people who leave the
Yeah.
profession. And I'm trying to make my consultations as interesting, as educational as possible for the clients, but also it's very selfish. I'm making them as interesting as possible for me. For example, I'll ask the people, what do they do for a living?
Yeah.
Because if you're a watercolor painter, I'm going to speak to you in a slightly different language to if you're an engineer, to if you're a physicist, or to if you're a doctor or a nurse. And I find that it's very interesting, because you can kind of say, right, you're a lawyer, therefore we're going to look at this incredibly logically, and we're going to go through the
Mm.
factual presentation. If you're an artist, you'll say, well, let's look at the big picture, let's see if we can fill in some color and what have you. I'm not trying to pull any wool over any eyes. I'm just trying to do the old thing of, when in Rome, speak Latin.
Mm.
It's speaking in a way such that you get the message across. It's all very well being clear in your mind what you're trying to say, but unless the client hears what you're trying to impart, unless it's in their hearing, not in your telling, really, that the communication
Yeah.
really happens, and that adds to the interest of the whole thing, I think.
Yeah. I mean, how many times, and I don't know how often it's happened to me, but certainly I think with most vets, when,
Mm,
I used to always write stuff down after the client,
yeah, yeah,
to give to the client.
yes,
But if you rely on that oral, communication, how many times do people go outside and the nurse or the receptionist goes, "Oh, are you all okay? When do you need the next appointment?" Or I don't know.
mm,
I don't really know what they said because, as you said, if you speak to somebody very, very technically with somebody who hasn't got that scientific
yeah,
language, then of course you're
yeah,
excluding them from the well, I call it a square now. That relationship. I always talk about the three people in the room: the dog,
mm,
the owner, and the vet. And
mm,
I also add that kind of environmental impact and element
yeah.
to it. But unless you have that triangle really working effectively, then this is where treatment breakdowns happen and you have a lack of success with your diagnosis and then obviously with your treatment.
Yeah, during my first consultation, this is the 45 to 60-minute consultation, which is a luxury. And I think after over 30 years in the business, um, I'm entitled to a little bit of luxury.
Mm.
Uh, I will write up key points from the consultation, and I will email those to the vet. But I will also email CC the client in exactly
Yes.
the same notes, and I will write them such the vet can understand them, but I'll write them such that the client can understand them as well,
Yeah.
so that we have complete transparency, complete communication. I say to clients, good medicine is 90% good communication, and I think that that's
Yeah.
that's
I think
that's
I
really
think
vital.
I think you see that with the Royal College, the number of complaints that the Royal College have, if you break them down, the majority are down to a failure in, as we call it, soft skills,
Yeah.
which is broadly communication. And just again going to your point around history, uh, I often would take sort of 20 minutes, 25 minutes taking the history at
Mm,
least.
mm,
And during that time, when you're taking a history, you're not only listening, but you're looking as well, and you're getting a feel for the client, what the client's about.
mhm,
It's so helpful, as you've said, if you understand the client more,
mm,
to have
mm.
a better result. But actually, just sometimes looking, at the animal in that 20 minutes rather than just
Yep,
immediately dive on top of it, and want
yep,
to get a
yep.
stethoscope or a thermometer out, allows the dog to settle, the cat to settle down. But also, you begin to see the behaviour that it's showing when it's at home as well.
Yeah, very much so. I will often say at the beginning of the consultation, I'm going to deliberately ignore the dog. Take a seat, make yourself at home. If I'm seeing them face to face, cup of tea, cup of coffee, because
Mm,
I think you'll get the best information when they are. When they are relaxed, and when they're relaxed, the dog is going to be relaxed, and you're going to
mm,
see the true nature of the dog. Obviously, this is, we're talking specialist consultations, and if you've just got a 10-minute consultation, you haven't got this luxury. But what's to stop the profession saying, right, that's it, we're all going to go to 20-25 minute consultations? It means that you'd have to charge more for the consultation,
mm,
but I would wager that you would maybe your drug bill would go down, because you'd be able to focus in on the problem, and rather than
mm,
taking 3 consultations to achieve a result, you might be able to say, you might be able to get there a little more quickly and be much more specific with your prescription, or maybe not make a prescription at all, because you've educated the client, you've examined the dog, and you've explained what might be
mm.
happening with the dog. Just do this, Mrs. Jones, or try this, or read this book, and then come back to me in a couple of weeks, something like that. I think we're very pharmaceutically orientated, and we have got more so over the last 30-40 years.
Yeah, my ethos was always use it as little as possible. Obviously, you do, or you did. I used antibiotics as a dermatologist, etc.
Yeah, for
But
sure.
it's interesting, even that now. I've been out of dermatology practice for the last 6 years, and again, we've started to think, well, actually, um, giving that 3 week of antibiotics, is that the right thing to do? Can we use topicals more,
Mm,
etc.,
mm,
etc. One of my favorite lecturers is a guy called Mike Willard, who's a Texas A&M professor, retired now, in
mm.
gastroenterology.
Okay.
A great man, and he would often say on a webinar, what I taught you 10 years ago was a lie. I just didn't realize.
Yes.
So things do change, and I think it's interesting. Often you get a dog in that is massively overweight and has hip dysplasia.
Mm,
Is
mm,
the treatment non-steroidals, or is it, reducing weight? I would have tended to have used, a Hills RD or a obesity diet from Royal Canin.
mm, mm.
I mean, as a student, I used to go to a practice, and their sales of Leo obesity diet, which was just starting then, sort of 35 years ago, would go through the roof, because in my view, the obesity was more important than the arthritis, because if we reduce the obesity, probably the arthritis would go a lot better. I mean, how would you
Yeah.
treat a case like that coming through the door to you?
Did you know the Webinar Vet Virtual Veterinary Congress is back for 2024? Starting on the 5th of February, we have 10 hours of continuing education with speakers such as Sarah Heath, John Chissy and Samantha Taylor, and many, many more. We'd love to see you there. If you'd like to get involved again this year, or if you'd like to join us for the very first time, please click the link in the description below to find out more.
Well, just following up from your idea of 10 years down the line, half of what I told you. There was a guy called David Sackett. Do you know David Sackett? He's the father of evidence-based medicine,
Yeah,
and he had a paper in the BMJ in '76 which kicked off really the evidence-based thing. And I'd love to talk to you about that. But he said half of what you learn in medical school will be shown to be either dead wrong or out of date within 5 years of graduation. The trouble is, nobody can tell which half. The most
yes,
important thing, this is the important thing, Anthony, the most important thing is to learn how to learn on your own. And that kind of keys into this idea of stimulate your brain in practice. You can't just do the same thing every single day. If you learn a new skill, you learn a new toolbox, like I did with homeopathy and acupuncture, and now very much so looking at the raw food thing. That's what keeps me going,
yeah,
and that's so important. Now, going back to your case, to your point, you were saying about, so what, you've got an obese dog, and he's being fed some standard, um, big food, kibble from Purina or Royal Canin or Hills, what would I do in that situation? And is he lame as well?
He's lame. He's got osteoarthritis. You know, the point was, it's very easy to send that dog home with non-steroidals, but
Non-steroidals.
actually
Yep.
you need to spend more time with the client to say, actually, this dog needs to lose weight, and if it loses weight,
Yeah.
it may not need the non-steroidals long term.
Yeah, totally. Okay, so let's look at that as a case example. Alex German in 2017 did a study, and he found that 74% of dogs were overweight or obese. Okay, and that was that was 6 years ago now.
Yeah.
I would say that and just walking down the high street, I would say 8 out of 10 dogs are either overweight or obese. So that's your number one thing. I would be looking at a raw food diet, because I find most dogs who go on a well constructed, varied raw food diet will usually lose weight, because what we know is that kibble has a very high carb content, and now with the advent of low carb diets within human medicine for heart disease, for predisposition to stroke and to metabolic disease and diabetes, it's big news. There's a guy called Dr. Asim Malhotra. If you hadn't seen any of his videos on YouTube, definitely worth having a look at him. And so what we would do is we go over onto a raw food diet, which would be by definition zero grain free. That's got connotations. We can go there if you like, but let's just say it's going to be based on meat and bone and organ meat, i.e. we're feeding a carnivore like a carnivore. There's going to be some green veggie material in there, maybe some nuts, herbs and seeds, maybe an omega-3 source that'll make you happy as a dermatologist. And what we find is that we're feeding 2 to 3% of body weight typically, and we will see those dogs will just slim down to where they need to be. Now, if they're on 2% of body weight, which is kind of the bottom end of where I'd have most adult dogs, and they're not losing weight, and maybe they've got maybe a little bit of bilateral alopecia, or maybe they are a bit on the chilly side, or even aggressive, or maybe suddenly they're noise phobic. There's a fantastic book by a US clinician, Dr. Jean Dodds, who wrote this book called The Canine Thyroid Epidemic. And basically she's saying there's a whole lot more hypothyroidism out there, guys, than we were taught at college. Not every hypothyroid is fat and chilly and sluggish. Yeah, she says 40% of aggressive dogs in the States are hypothyroid, for example. So if anything doesn't make sense with a case, or if we're feeding the dog the bare minimum, they're still not losing weight, I think that's a fair idea to take some blood. I send it off to Jean Dodds in the States, because she's been doing it for 30, 40 years, and therefore she can compare any given age, breed and sex with hundreds, if not thousands of others of the same age, breed and sex. So it's a very powerful database that she's got. And so I'd be looking at that. In terms of losing weight, we'd also talk about exercise. Exercise is a minor part. You can't outrun a bad diet. So we'd be talking about, routine exercise. Treats, we'd be talking about treats. I would try and get the treats as single protein without any carb or preservatives, additives and what have you, which can disrupt the microbiome. And we would be doing that, and that will often be very effective. And as you say, if you can lose the weight on that dog, then the arthritis can improve immensely. However, what I would be doing, just from my holistic perspective, in order to try and avoid non-steroidals, I haven't got a problem with non-steroidals. I've even got some in the cupboard over here behind me. But if I have to use non-steroidals, I think that I failed the case. Okay, I will use them for the welfare of the dog, but I just don't feel right in myself. And so what we'll do is we'll lose weight, but also I'm going to use a chiropractor or an osteopath. I find these people immensely useful. If your back is bad, Anthony, what will you do? Will you go to the doctor? You won't, because he'll just give you ibuprofen and say take a week off work. Okay, but you'll go to the osteopath and chiropractor, and maybe you're walking a bit crooked, or your bag is too heavy, or your car seat needs adjusting or something, and you do some simple intervention, some simple adjustments, and you're a new person. And we know that this is the case. Look at in the Olympics, there are physios, osteopath, chiropractors, left, right, and center. So these guys are very, very important, especially if lameness comes along after surgery, things like this. Even if it wasn't surgery for the musculoskeletal system, it was like, I don't know, stomach surgery or a pyometra or something like that. You can get jarred during surgery, and these guys can help you with symmetry, left and right symmetry, and also front and back symmetry, so that you've got good weight distribution.
As a pretty tall person, my back is quite good, but I do go to a chiropractor. I do have a bit of subluxation of one of my hips, so he shoves that back in and stops me running around in circles then.
This is it, and I use these guys often in practice. They're not here. I haven't, in my practice, I've got a very simple practice. I just say, right, this is Tony's number. Go and see him. Lovely guy, Tony Nevin, based in Cheltenham, but he travels all over. He goes to Lambourne and does the horses there. In fact, at the moment, he's in Thailand doing elephants, of all things.
Oh, wow.
He's a clever guy, really lovely guy. He does my back as well. So we're really
You
good.
need a
What
ladder
else
for that job, Nick.
You need a ladder for elephants.
For elephants, I would presume, unless he's extremely tall.
He's not. He's shorter than me, and he's just very clever. He'll do what he can from the ground. Will he? I don't know. I don't know what he does, actually. I've only ever seen him working from the ground, but I would imagine he's not averse, if he can, to get on top and maybe do a bit of work there, and it's effective. He goes out there every year. They're not fools. They wouldn't be getting him back just because they like what he does. Okay, so we would do that. So we'd look at the weight, we'd look at symmetry and optimizing the musculoskeletal efficiency of that animal, depending on whatever it did, whether it sat by the fire all day or whether it was an athlete. We would be then looking at supplements, perhaps to support joint health. That's not complicated these days. You can get chondroitin glucosamine products left, right, and center. You know about those. But also we use one that has boswellia in it. Boswellia is frankincense. It's an anti-inflammatory. In order to try and just to delay the day that we have to use analgesics, non-steroidals, the gabapentins, even the steroids of this world. If we can delay that thing, I have no problem using them. But if we can delay the use, why wouldn't we? So we'd be thinking also about acupuncture. We would be thinking about making sure that the animal was hydrated, and having the very best of bone broths and things like this, again to support the joints. So there's a whole raft of things, and what I say to people is, please bring the dog as in the early stages, so that we can put on a treatment, and then if we have to layer on another a bit further down the line, then we will. If we have to layer something on a little bit further down the line, and when those layers are insufficient, then we're in non-steroidal territory, and we'll support the dog, the liver, the kidneys, so as to maximize the efficacy of that non-steroidal. But also we will be supporting the home side, the dog itself, and not just saying, here's your Metacam, good to go. Take a bag of Hills while you're on your way out. You don't eat ultra processed food. I don't eat ultra processed food, and I think it would be fantastic to educate the profession into the place where they thought outside the box, the kibble, the cans box.
I mean, this is obviously a really controversial area. We've talked about it at Webinar Vet, and it's
Mm,
it raises hackles from both sides, I think, because there are evangelists on both sides. Talk
mm,
to me a little bit about raw feeding, because,
yeah,
obviously we talk about evidence-based medicine. You were talking about that.
yeah.
High levels of salmonella in some raw feeds. Are there better feeds than others? I think, to me, it seems like we have to make sure we're picking the right one, because I absolutely
Yeah.
agree. The dog is a
Mm,
carnivore. That's what it was doing, 10,000 years ago. But it
yeah.
was also eating very fresh meat. My worry is always that,
Mm,
how old is this meat when the dog's eating it? Can it cause
okay.
problems as well? I think we're probably somewhere in the middle. I tend to be more of a moderate in that sense. So come on, tell me a little bit about
Yeah.
uh, what are the reasons that people should be thinking much more seriously? And obviously, I know it is out there, and there are a lot of people who are using it. But I think
Yeah.
the profession um, is probably, there's not as many people talking about raw feeding. I think most people do. We've always fed with kibble and with tins or
Mm,
pouches.
mm,
So,
mm, mm.
why should we change?
Okay. So you said about salmonella. So the first thing is all the DEFRA registered producers, they have a zero tolerance of salmonella. Yeah, they're testing for it, and they have a very um, high vigilance for salmonella.
Yeah,
So the likelihood of getting salmonella in any good quality product in the UK is pretty low, if not zero. But did you see there was a couple of weeks ago there was a paper, and they did a study in the States, and they took, I think, 34 different kibbled feeds, and they analyzed them for pathogens. They found pathogens in every single one. Okay, and there are other papers from about 2006 to 2010, and they looked at the incidence of salmonella in dried food, kibble, and they found that there were hundreds of incidents, especially in toddlers, because toddlers are down at the level with the dog, and they can stick their hands in the bowl, because often people will kind of graze feed kibble because it's easier. And they were finding that there were just swathes of people being injured from their dried kibble. If you look for those papers from raw feed, I think you'd be hard pressed to find them. So the science doesn't back up this uh, intuitive feel that, oh my god, it's got loads of salmonella and all sorts of horrendous pathogens, E. coli, and this kind of thing. We just don't see it on the cold face. We don't see it. I'm in touch with raw feeders all around the world. We've got the Raw Feeding Veterinary Society, and so we're in close communication with each other. We just don't see it. And the other thing is, Anthony, is that I can guarantee, because there are certain interests that would make it happen, if a dog or a child or somebody went down with salmonella from raw food, it would be on the front of the Daily Mail in 3 seconds flat.
yeah,
Okay. And we just don't see those kind of reports. Okay. So I think dogs are very good, that we transition them onto a raw food, and they do very well. The trick is to communicate with one of the reputable raw feeding companies in the UK. There are plenty. If you go to Google, look at the top 10, the top 20, they're probably going to be pretty good. If there are colleagues watching this who want to be put in touch, or they're thinking, I'd love to do it, but I just don't know where to start, please give me a shout. Nick Thompson at holisticvet.co.uk. I'm sure that Charlie will put it in the
yeah,
show notes, as they say. I feel like Russell Brand here. Yeah, it's in the
yeah,
show notes. Tell
yeah,
us what you think, and all that stuff. Visit the website if you want to look. Visit the Raw Feeding Veterinary Society if you don't want to talk to me. Email me. I speak to conventional colleagues all the time, and I'm really, really happy to do so, because I think raw feeding is a fantastic opportunity for dermatologists, for orthopedic, for gastroenterologists, internal medicine guys. This is just a massive opportunity, and I'm really happy to talk to you about it, or put you in touch with somebody closer to you who can help you along that journey. Um,
What about home prepared diets?
Home
Obviously,
prepared,
I
great.
used to feed a lot of fish and potato to my dogs
Yeah,
that were
yeah,
going to be
yeah.
going on to food trials. What is the big thing about it needs to be cooked, if you like? Or, with
Okay.
raw feed, it doesn't need to be cooked.
So raw feed by definition hasn't been cooked, but you can fresh within the raw feeding world. We talk about raw food and fresh food. Fresh food is lightly cooked fresh material. Yeah, it hasn't been through a an extruder. It hasn't been canned for a year
Yes.
before it gets into your dog. Okay, so this is moving away from ultra processed food. This is what the kind of food that you and I eat. It's just lightly cooked, very healthy, freshly sourced, and you're buying and eating, cooking lightly and consuming on a regular basis. It's a great way to feed, and I haven't got a problem with that. So for me, raw and fresh, both really useful because they keep you away from the ultra processed foods, which we're all told by our doctors not to eat. So the way that I summarize this conversation, Anthony, and I have it quite a lot, as you can imagine, is benefits, bugs, balance, and bones. These are in 2012, the World Small Animal Veterinary Association came out with these criticisms. Benefits, there's no benefits. Well, I can give you 20, 30 papers demonstrating benefits. I bet you can't give me one where kibbled food is demonstrated to be superior to raw food. And I can give you several which show exactly that, where raw is superior in terms of microbiome, in terms of stool quality, in terms of reducing homocysteine levels in the blood, in terms of reducing atopy in pups born to raw fed mothers. I can give you all the studies here, guys. Just email me and I'll send them. So benefits, yes, there are benefits. World Small Animal Veterinary Association says there aren't. Bugs, yes, there are low levels of bugs. Salmonella, very unlikely in the UK, but there are 2,000 different types of salmonella. There's only about a dozen which are actually pathogenic, and even if they are at a very low level that aren't really detectable, I think that the raw fed dog, because they have this continual exposure to low levels of these bugs, which is a bit like going for a walk in the park, coming home and licking your feet, which is what dogs do. It's a low level of exposure to bugs, which humans don't do very much these days. I think it's very healthy, and the proof of the pudding is that the average raw fed dog goes to the vet a lot less than the average kibble fed dog. We're just about to do a study where we're looking at the figures within a large raw and kibble feeding practice, and we're going to compare vet bills and vet visits and what have you. So that's an ongoing study that's coming out soon, but I can almost guarantee what the results would be. Back to the WSAVA, benefits, bugs. Now, balance, which was your original question. Balance. When was the last time you, Anthony, ate a balanced meal?
Well, I'd like to think, if you're eating, well, either meat, vegetable, or whatever, I suppose the proof of the pudding is in the eating, isn't it? If you suddenly start having lots of problems, you're going to the doctors a lot, you've got blood work that's all over the place, then
Yeah,
presumably you're
yeah.
not doing it. My wife always says everything in moderation. So if you're
I
doing a bit of
completely
everything in
agree.
moderation, you're probably there or thereabouts.
But I don't know that I've ever had a balanced meal in my entire life. And if I did, I didn't know about it. And yet we
Yeah,
are
exactly.
sold every meal has got to be balanced. That's the only way you do it. You are a bad owner unless you are feeding every meal a balanced meal. That's that's the that's the subtext, yeah?
Yeah.
And yet humans have existed for 3 million years on a variety of foods. So I think dogs have as well. So I think that if the diet is balanced, now the diet is a thing that you have over 3 or 4 weeks. If the
Yeah.
diet is balanced, you're in great shape, whether that's fresh or whether that's raw. That's how it's been done. Dogs can't read. They've been feeding themselves for millions of years, ditto humans, etc. So benefit, bugs, balance. So the whole balance thing, yes, if you take any individual meal, it may not be balanced, but that meal is not the diet.
Yes.
And so we're taking a much more physiological, much more evolutionary approach to to eat, a much more practical approach to food. Essentially, we feed a variety. Variety is the ingredient that doesn't go in the bowl. It is the element that is absolutely essential. Mrs. Jones might say, oh, my dog likes chicken and a bit of cabbage, and so I'll feed chicken and cabbage for the rest of the dog's life. Wrong. Even though if that's raw, that's not a raw diet, Mrs. Jones. That is chicken and cabbage. Yeah. Where are your organs? Where are your bones? Where are your nuts, herbs, seeds? Where's your omega-3s? Okay. So it doesn't take much to create a balanced raw food. And the key to the whole thing, and I shouldn't say this because this is my livelihood, is if you feed variety, if you get your macronutrients, like your wife was saying, bit of everything, moderation in all things, you get your macronutrients right, and you have variety, seasonal variety, fresh and what have you, your body will look after itself, because that's what it's been doing for millions of years. And so that's what we do. So benefits, bugs, balance, and bones. The last thing that the WSAVO and many vets will get really terrified about is bones. And I'm going to say here, officially, I think that if you feed cooked bones to dogs, you're going to get problems. You may get a problem tomorrow, or you maybe a year down the line, but I can almost guarantee sooner or later you are going to get problems. However, dogs do very well on raw bones. Will you never, ever, 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 ever have a problem with a raw bone? I can't say that, but I think it's a bit like driving a car or getting in an aeroplane. The benefits substantially outweigh the risks. And if you're a careful driver, then you're probably going to get through your entire driving career with nothing but a scrape or two. And that's the feeding of bones. I've done a video. It's called Bones and How to Feed Them. On my website, he says, plugging away relentlessly. But it basically says, we look at it, it's a bit like kindergarten, primary school, secondary school, and college. You'd start a dog with very simple, soft chicken carcasses down at the bottom end. And this would be for pups from 3 weeks. But these would be for adult dogs if they've just come over from kibble, and you're thinking, right, well, let's get them onto some bones. You've got to do it gradually. We all learn these things. So kindergarten would be soft chicken carcasses. Then you'd move up to chicken wings, turkey necks, duck necks, things like that. And then you'd move on to maybe some lamb ribs, maybe a bit of beef rib, maybe a bit of beef brisket. Yeah, non-weight bearing bones. And only then this is at the college level for bones, only at the top end. This is the veteran bone eater when their gastric juice is good and strong, their enzymes and their microbiome is in great shape because they've been eating raw food for a good long time. I'm talking a year down the line or more. You could maybe think about the marrow bone. The problem is Mrs. Jones will often go straight for the marrow bone and then wonder why the dog gets sick because of all the marrow all in one go, or the dog doesn't know how to eat a marrow bone and it crunches this brittle fresh bone. It's got to always be fresh, and then doesn't know what to do with the chunks, So there are ways of doing these things very safely, very simply, and it's very successful. Dogs were not meant to have dentals every year, every 2 years, every 3 years. It stands to reason, and you can keep a dog generally off the dental table, off the operating table, by using raw food. It's not absolute, I'd say, but I'd say that raw fed dogs have a lot less necessity for dentals.
No, it's really fascinating, Nick. And I think at Webinar Vet, we want to be able to see both sides of the story because that's how you make the judgment. I think before you were talking about, you leave college, and I talk about this as well. You set your own curriculum, and we all set different curriculums. Mine was dermatology, mine was online learning. And I think that whole idea that we should always be open to stuff and to lifelong learn is so important because, as you say, we're all clever boys and girls. And if we actually stop learning when we're, 25, 30, shortly after university, that's when the job becomes quite tiresome. But it, in my view, I'm not practicing, but I did 25 years. It's one of, if not the best jobs in the world. And we probably don't have time to talk a lot about attrition and so on, but maybe that's for another podcast.
I'd love to. Yeah, let's do it. I mean, there's a lot to talk about. I think vets go into it for the right reason. Nobody, goes into veterinary medicine to be a millionaire, because you're in the wrong job, essentially. And we do it because we want happy patients, happy owners, and we want to make a difference. It sounds trite, but actually we want to spend our time doing something that means something. And if we can get something back in interest, in great positive feedback, in learning about the world, our environment. We didn't even talk about the environment, Anthony. Learning about the environment, learning about regenerative agriculture. There's another topic that we didn't cover. All because it's all related. And when I treat patients, I will also be looking at the owner. Is the understanding is and often owner will say, "Oh my God, you've just described what's wrong with me." In terms of eczema, in terms of pancreatitis, in terms of food sensitivities, in terms of necessity for a remedy or for a herb or something like this. And there's a lot of tie up, and I love that holistic approach to let me teach you what I know about this condition, and let's bring the whole family in. Let's work hand in hand with your vet, and let's get the osteopath in, and we're all going to work in the same direction. We're all on the same page, and we're all moving in the same direction for the sake of the client. It's enjoyable. The client is delighted. We're much more likely to get a favorable outcome, and it's a win-win situation. In these days where the profession is struggling a wee bit, I think it's holistic medicine can offer an awful lot, and it's not woo-woo, la-la. It's a lot of hard hitting. There's a lot of great science out there, and we're just looking at things from a slightly different perspective. We're broadening our view to try and achieve the very best of outcomes.
Yeah, and I agree. I think one of the big things, as vets, it is a fantastic profession to be in. It's a friendly profession to be in. I think that's because the majority of the people are purpose-centered. They create purpose-centered businesses that are there to do good in the world. They're not there necessarily, as you say, to make the maximum amount of money by, ripping people off or whatever. There's very much a good heart and a purpose to what we do. So thanks for some of those.
We're results driven. And we're exactly the same. The raw feeding brigade, the holistic brigade, the acupuncture brigade. We want results. We're just coming at it from a different direction. We don't ignore the drugs. I think drugs are great, but I wouldn't want them on my cornflakes.
Yeah, exactly. No, well, they probably don't taste very good, Nick.
Well, if we're going to go there, you shouldn't really be eating cornflakes.
Well, this is true. Yes, porridge in the morning, much better. You should know that. You spent 5 years in Edinburgh.
That's another conversation we can have, Anthony. Breakfast and intermittent fasting and these kind of things. That's an interesting conversation.
Yeah, definitely. Let's do it again sometime, Nick.
Love to, Anthony.
Thank you so much, Nick. Thank you so much for listening, everybody. This has been Anthony Chadwick at VETchat, the #1 UK veterinary podcast. Looking forward to seeing you on a podcast or a webinar very soon. Take care. Bye-bye.